It was 4th of July weekend, and a family of 5 decided to take their children to the lake for recreational activities to enjoy on the holiday. The 3 children were 5, 7, and 9. 9-year-old was a little boy. They engaged in activities. The 9-year-old could swim, so he was able to do a little bit more in the water, and they played in the water for several hours on this bright, sunny, warm July day in Texas. The next day, the child was difficult to arouse, actually, and this was unusual for the child, but the parents assumed that he played in the water yesterday. It was very draining. It was very hot outside. So now that he's up, he seems to be okay. Mild headache, maybe got a little sunburn, maybe a little dehydration. We're going to just keep watching him. And that's what they did. Later that evening, though, the child starts vomiting. Temperature goes up. It's 101 degrees. So the parents take the child to urgent care. The next day, the child is worse. He cannot tolerate PO, meaning that he cannot keep anything down. He has a fever. So the parents decide to take him to the emergency department. In the emergency department, especially since he had been seen by a provider the day before, they decide to do a little bit more testing. They do blood tests, they do a chest x-ray, they redo the swabs, the strep, the COVID, the flu, and all of those tests are negative. The only significant finding was on his CBC. He had an elevated white count. This caused a little concern for the ER doctors. So the patient was admitted, and the next morning, the patient was very difficult to arouse, complained of headache, and basically just looked very sick. When they do the spinal tap, the pressures are very high, which indicate that there's probably something going on. The CSF is usually like a clear champagne color. The CSF was very cloudy and it was very red, which is unusual. So they send the CSF for all the standard studies and some atypical studies. The CSF demonstrates the presence of an amoeba. So let's talk a little bit about this amoeba. Free-living amoebas are protozoan parasites with a worldwide distribution. They can cause, as in this case, what is called a primary amoebic meningoencephalitis. That means that the amoeba causes infection, inflammation in the brain and spinal cord and in the tissues around the brain and spinal cord. This particular amoeba loves warm water, and it loves fresh water and lives in soils. So you have lakes, ponds, little irrigation canals, streams, unchlorinated swimming pools, areas of sewage, hot springs. They all are great environments for the growth of this amoeba. The most common risk factor for infection is recreational water activities such as being in a lake on the 4th of July. And there is some concern about climate change and what this may do to the temperature of water. I think it's important to realize that just because you're exposed doesn't mean that you'll get the disease. There are people who are exposed to it, but they don't get sick. But it's also interesting to know that you could have a healthy immune system, get exposed, and get sick. So this is not a disease that only happens in immunocompromised populations. Transmission to humans primarily occurs through the inhalation of infested water, through activities in recreational engagement. What happens is the trophozoites penetrate the mucosa in the nose and crosses the cribriform plates and ultimately reaches the olfactory bulb, which is the nerve that you use to smell. Also, there have been cases where the amoeba gains access to the area around the brain through the ears. So this disease is associated with a very high mortality rate. The case fatality rate actually approaches 100%. The incubation time, the time from exposure to the time of disease, ranges from about 1 day to about 5 days to a week. Average time from infection to death is about 6 days to about 12 days. Sometimes, meningitis can be very hard to diagnose, especially in children, because it starts off as a regular type of viral syndrome, right? In this particular case, the suspicion was high because the child's behavior started to change, coupled with the temporal relationship of the exposure to the warm lake water on the 4th of July, helped this treating team make the diagnosis pretty quickly. Unfortunately, because of the high mortality, this child did not make it, and he died on hospital day number 10.